So hello and welcome. My name is Anya from Yoga Embodied, and aside from yoga, one of my passions is all about the pelvic floor, and for both men and women, but my kind of knowledge is more about female pelvic health, but I do want to talk a little bit about whether you're a man or a woman anatomically. So I'm going to talk about massaging the pelvic floor, perineal massage, and also vaginal massage. And it's really something you can do on your own or you can do with a loved one. And we often talk about perineal massage when it comes to pregnancy and preparing for labor and for birth. And that's an amazing time to start to practice. And we usually say around 34, 36 weeks, depending on what's going on in your pregnancy. But really for all of us, the muscles of the pelvic floor can be very tense and tight. And just from posture or how we move around or how we hold tension in the body. So, I do a whole course on that in the sacredpelvis.com, and I have some free videos as well, so you can kind of explore that more. But now I want to talk about the self-massage or the massage you might do with a loved one. So I have a model of a pelvis, and this is a female pelvis, so obviously slightly different anatomy for a man, but I just want to share what we can all massage. So this is, if you are lying on your back, this is how the pelvic floor would look like. So this part is pretty similar. The muscles are different, and actually a lot of men have very tight muscles around the anus. It's a very strong muscle, specifically for men. And obviously here you have the genitals, and this is the female body, so you can see the difference here. But the one place we're going to concentrate on just to start with is the perineal body. So you have the anus here, and then the genitals here, and it's a space in between the perineal body. And this is, you can see the muscles. As you will not look like this because you will have skin across it. So it looks very different. Obviously all bodies are looking different. But the perineum, just a little bit of bone is falling off, and hopefully that shouldn't happen in your body. But the perineum here can be really tense and tight. And if you have been pregnant or given birth, this is where an episiotomy would have taken place. If you've been tearing, this is where it would have taken place as well. But we can all massage here, and certainly in some traditions, it's a practice that's used to ground you or to enhance your sexual energy. So you could literally, if you do it on your own, the thumb is probably easier to use, and you can find the middle, and you could just go around in little clockwise directions. So I'm going to use the index finger just because in this model that's easier for me to do. You could just press gently on it or even kind of stretch out. This can be a really sensitive area, so if you had any trauma here at all, then check out with a physio or midwife or a practitioner that you're seeing. But you could literally just massage, little circular movement. You could kind of stretch it out, and we can all do that and just explore this area. Another place we have a lot of tension is around the sitting bones. So here we have the sitting bones, so these are also interesting areas that we can just kind of stretch out and massage ourselves. Best thing to do is obviously to use some kind of oil or lubricant, so there's a bit of ease in the movement. So whether you have female or male anatomy, this is a good kind of self-practice to just stretch out. And certainly, more specifically, if you're pregnant, around 34, 36 weeks is the classic textbook recommendation. But again, check if you do have any trauma, you want to just make sure it's okay for you. And you can start to kind of use a thick oil like wheat germ oil is often recommended because it has lots of vitamin E, and vitamin E is good for skin elasticity. But if you can't use wheat germ, then use any other oil, grapeseed oil or avocado oil is another really thick oil. Olive oil is fine as well. But you can just stretch this area out. And after birth as well, if you have any scar tissue, you want to have the go-ahead that it's fine for you to start to touch this area, and all the scarring has healed, but this might still be scar tissue. Again, you can do a bit of massage to break down some of the scar tissue. So this is one massage. So the next massage techniques I will talk about is specifically for women. So this is working in the vaginal canal, and you can, if we continue talking about pregnancy, we are kind of moving down and giving a bit of pressure towards the perineum, because when you give birth, obviously the vaginal canal, this is just rigid, but it's obviously very movable. These muscles can stretch immensely. It's incredible. Our bodies are absolutely amazing. So it is designed to give birth. But you can kind of stretch into that area as well. So I'm gonna just put this one away, and I'll use my hand instead to show you. So if we we'll do like this. My fingers here as the vaginal opening. Down here would be the perineum, or the perineal body, so that area here that moves down towards the anus, and up here would be towards the clitoris and the urinary tract. So if this was a clock, you could say this would be 12 o'clock and this would be 6 o'clock. And depending on how you're looking at me, for me, I guess this would be 3 o'clock, 6 o'clock and 9 o'clock. The area up here is quite sensitive. It's towards your bladder, so you don't really want to touch that area. So you could work maybe from 3, let's say 3 or 4 o'clock, all the way up to 8 or 9 o'clock. So that's kind of the area you would work in. Now this area is the perineal body, so you could put in your thumb and just give a gentle pressure down towards the perineum. So you're basically trying to stretch out the vaginal opening and create elasticity, so that it's easier, hopefully, to birth your baby if you have a vaginal birth. So you can start to again use lots of lubricant, but literally just the thumb to the first knuckle. You don't need to go any further in, and you just massage down. And you want to find that space where, like when you have a massage, you don't want it to be really, really painful, but you want to feel some sensation, but not pain. So again, you can just press down from 3 or 4 o'clock and then to 6 o'clock. And you just hold it and press down 4 o'clock. And you could even hold, especially kind of the lower movements from 5 to 7. You could hold that for quite a while, just to help that stretch out. But again, this is something you would do maybe around 34 weeks or 36 weeks before you give birth, and you just want to double check that with your midwife or your whatever consultant you're seeing. If you are not pregnant, you could go a bit further and do the same movement. You don't want to overstretch, but just to kind of check out what's going on, if you have tension in that area, and also after birth if you have any old scar tissue. So again, not straight after birth, but after a little while you can start doing that when everything is healed. So for the rest of us, we can definitely do that. So I want to share one more technique to practice. So if you're pregnant, and then in the past 4-6 weeks of your the last 4-6 weeks of your pregnancy, obviously you don't know how long it's going to be, but from let's say 34-36 weeks, you can do this every day, and either recline down on lots of cushions, or you can do side lying. And for most women, the thumb is easier to use, and obviously you can have your partner help you out as well. So one more technique I will share that's good to use whether you're pregnant or not pregnant is really just that gentle massage. So you can again use whatever finger is easier, insert it just to the first knuckle, and you can kind of stretch down towards the 6 o'clock, so towards the perineal body. So here from 9 o'clock. down towards 6 o'clock. So just kind of stretching down. So you're just giving yourself a massage. You know, again, we have so much tension in our bodies. So again, you just stretch down and stretch down. And you might find spaces in your body that's like, oh, this feels a bit tense. And, you know, go ahead and hold it, massage it a bit, and release back down again. And you find that area in another place, you can stay there, you can massage it a little bit, and then stretch it all the way down again. Now, if you're pregnant, just use the first knuckle. Just go to the first knuckle, that's fine. If you are absolutely healthy, you can, we think of the pelvic floor having 3 layers. So we have the first layer, so if you just insert to the first layer, you could also insert to the next knuckle, and that would be working towards the second layer of the pelvic floor muscles, or you can go all the way in to the third layer. Now, if you do go into the third layer, there are ligaments further inside the vaginal canal, and you don't really want to press on that ligament. It feels very different to the rest of the muscles. So if you touch that, just go below or above it. And then the rest of it, you can really, you know, you can massage. So that's really what I wanted to share. So 3 different massage techniques. One that we can all do, which is at the perineum. So between the genitals, whether it's a male or female genitalia, and the anus, and massage that area. And then for women, inserting, easiest way, inserting the thumb if you do it on yourself, pressing down towards the perineal area, or the perineal body, and then that sweeping movement from, you know, what would be 3 o'clock to 6 o'clock, 9 o'clock to 6 o'clock, or a little bit less. And, you know, the interesting thing when you start to massage your own body, especially in this area, some of us, we don't think about it, we don't really associate ourselves with this area. You find different parts of your body that creates different sensations. So always go to where you feel comfortable. And again, if you have any sorts of trauma, you know, work with a therapist that can help you release that. And if there's any kind of scar tissue, if you had traumatic births or anything else going on, you know, again, to see a pelvic specialist as well. And obviously, once you're down there, you can check how you actually work your pelvic floor muscles as well. So the sense of that you can actually squeeze in and lift up rather than pressing down. So this is a perfect time, since you're already there touching. You know, sometimes I talk about kind of the expansion and contraction, and you can feel just breathing. You should be able to see how the pelvic floor moves, or even if you just gently touch the perineum, or even just kind of cupping over your vulva and the perineum, you can feel the expansion and the contraction with the breath. But obviously, if you insert your finger inside your vagina anyway when you do your massage, it would be interesting to see how it feels. That's it. I could go on about the pelvic floor and the pelvic floor muscles, but I will stop because I think that's it. If you have any questions, do let me know. And I have a blog post on this as well on yogaembodied.com. And yeah, that's it. And go to sacredpelvis.com to learn more about the pelvic floor, or if you go to yogaembodiedonline.com/videos, there's some free videos as well. So enjoy the rest of the day, and thank you so much for watching. Thank you. Bye.